So, ladies and gentlemen, we are absolutely delighted to have Dr. Shubhra Goel with us today, live on Facebook. And we are apologetic for a little bit. There was some technical glitch in the beginning, and now we've corrected it. And now we have the award-winning, the very renowned and respected Dr. Goel. Dr. Goel, good evening to you.
Good evening, Deepak, and pleasure is all mine to join in this fascinating topic, which is very close to my heart, the dark circles.
Awesome, fabulous. So before we get on to dark circles and a lot of questions have been coming up, can we get a little bit of a personal intro and a little bit of your professional journey, Dr. Shubhra, your background a little bit?
Yes, of course. So I'm an oculoplastic surgeon. What it means is that we are trained for anything to do around the eyes and on the face. So my specialty is called as oculofacial plastic surgery. As the name suggests, oculo means eyes, facial means face. So in nutshell, for the common man to understand, it is the eye and face corrective treatments which we do. And these treatments can be for functional conditions, for cosmetic conditions or issues, and can be done both surgically and non-surgically. So this is what I specialize in. As far as my journey is concerned, it's been a fascinating journey because I did my postgrad and undergrad from Mumbai. And then I moved into Chennai, Shankar Nethralaya Eye Hospital, where I did my fellowship in oculoplasty. So my basic degree is ophthalmology, but in ophthalmology, then we have super specialty. So oculoplasty was my super specialty, which I chose for. And then I worked there for a while, and then I moved to US for my further fellowship and training, which was in ophthalmic or oculofacial plastic surgery. So I was there in University of Wisconsin and LA for over a year. Then I came back and continued my journey at Nethralaya. We established first of its kind, aesthetic clinic in an eye hospital back in 2010. And then the journey continued, and presently I am in Hyderabad, and our work is being done under the banner or the team which is Clinica Phi. And Clinica Phi is very, very close to my heart because it is founded by me and my sister, who's also my co-founder, Prerna. And it is the whole concept of Clinica Phi is that we want people to love themselves and correct whatever they have, the issues, in the most holistic manner, by very tailor-made scientific treatment modalities which are available.
All right, great. So that's good introduction, Doctor. Doctor, let's get right into it. What are dark circles?
Okay, so dark circles, as the name suggests, that you have circles which are dark, and mainly these are two, they are called dark circles. Which people just understand dark circles when it is around the eyes, right? So something which is dark around the eyes is called dark circles in a very broad term, terminology. But dark circles themselves are very complicated entities because these are multifactorial. So just because you have pigmentation around the eyes does not mean that you have only dark circles. It could be something else. It could be something intrinsic, something happening inside the body, which may be affecting the pigmentation around the eyes and also the changes around the eyes. So this is in short about dark circles. And the way we look at dark circles, unfortunately, is that everybody is looking out for quick fixes. Everybody wants one single cream or a treatment modality to treat them. So I just want to convey here through this platform is that dark circles are not as simple as we think them to be. And it needs a very, very detailed examination, checkup, and a tailor-made approach to treat them.
All right, good. The next question I have is, why are there so many misconceptions about them?
I think misconceptions are part and parcel of anything which exists in the world. And so it is for dark circles. Also, the misconceptions are there because I don't think we have documented or talked about dark circles in a very scientific manner to the general population. As I mentioned, people think that dark circles means I would apply some cream, or I'll do some lasers, or I'll do something, and I will eradicate them. Also, people think that dark circles, or it has been created, the myth has been created, which is partly correct but not 100% correct, is that if people are tired, they have not slept for hours, if they drink less water, if they cry enough a lot, and if they have frequent change of glasses, this is what causes dark circles. Now, all of them are partly correct because they all aid in increasing the pre-existing dark circles but not cause the dark circles, right? So what is happening in the social media or in the knowledge bank which is provided to the general population is, we are talking about all these things and we are relating them to cause of dark circles, and I think whatever is there on the social media and projected in a certain way becomes a myth or a misconception. Unfortunately, these are not the only things which cause dark circles, and there are other facts related to it. So I will come to the facts in a manner where, see, dark circles, why it happens is because there are changes in the skin around the eyes, there are changes in the bony structure or the framework around the eyes, there are changes in the blood circulation around the eyes, there is changes in the pigmentation around the eyes, and there could be something which is changing you internally in terms of some deficiencies, allergies, diseases. And in addition, there is an ongoing aging process which is happening. So when you have such a complex thing, multifactorial complex thing happening, how can a lack of sleep or drinking less water be the only cause of dark circle? And so this, when the clarity is not there in a scientific manner, it creates a lot of misconceptions and myths.
Next question I have for you is, what makes them so difficult to treat?
I think this is again in continuation of what I just spoke about. It's not difficult to treat, it's difficult to eradicate dark circles, right? So if somebody comes to me and say, I want to get rid of my dark circles, well, in what stage are you presenting? What is the severity of the dark circles? What are the reasons for which you have dark circles? The treatment would depend accordingly, and hence the results of the treatment. So it's not that it's difficult to treat dark circles. It's difficult to eradicate them 100% in all the cases. So some amount of dark circles may remain. I'm not saying will remain, may remain in certain individuals. And again, if you look at the pathophysiology or the reasons why dark circles are happening, we are dealing at an internal level and external level. Internal level is, as I mentioned, about diseases, deficiencies, allergies, and so on and so forth. And at the external level, we are working at the skin level, the bone level, and the blood vasculature. And then there could be something called inherent dark circles, where people are having dark circles which has been running into families, or they have something called melanosis, where the pigment cells are so deep that no matter what you do, you cannot get rid of those pigments unless you really remove the whole skin and put in the new skin, which is practically impossible. So that's why it becomes a little tricky and a challenging proposition to eradicate dark circles. But yes, definitely, if somebody is patient, somebody is compliant, somebody who understands the whole pathophysiology and sticks to their physician in a very, very systematic manner, dark circles can definitely be lightened or made better over a period of time.
All right, good. Doc, we're definitely having technical difficulties, but I love the composure and love the attitude that we are we are on display here. And I also want to thank the audience for bearing with us and really trying to get along this journey. Quickly, Doctor, I combined two questions in one. What are the main causes of dark circles, and what are some of the treatments known to us and accessible that are available to us?
Yeah, I think I answered the question about the reasons for dark circles, but I would just repeat it for the benefit of the audience or just so that it sticks by. The causes for dark circles are that it could be hereditary or running into families where there is a basic problem in the way the melanin pigment, the pigment which causes pigmentation in the skin, is working around. Now, there could be some allergies and diseases. When I say diseases, something which causes water retention in the body, something which causes deficiencies of ferritin, B12, and so on and so forth. So this could be some of the reasons. And most of the reasons are that we have skin around the eyes, which becomes thin, which becomes wrinkly. It could become pigmented. Then there are blood vasculature, which can change. When I say blood vasculature, meaning the blood vessels, which are running below the eyelid skin, they start producing more fluid or the pigment of the hemoglobin, and the lower eyelid skin is very, very thin. It has a ground glass appearance, and everything which is beneath the skin will be seen through. So that happens. Then we have something called tear trough deformity, which is nothing but a bony deformity here which happens. And that happens because of an ongoing aging process where the depression becomes more and more. Again, some people may be born with a very deep tear trough deformity. Like, we call them khaddas below the eyelids. They're very deep set eyes and khaddas around the eyes. That can cause the shadow effect. And in addition, yes, the aging process, which can cause the elevations and depressions because of fat prolapse, fluid collection, and so on and so forth. So these are some of the basic causes. As I said, these are complex pyramid of causes which are there. Based on this, the treatment would be dependent upon. So if I have to deal with a patient who has only tear trough deformity or depression or the khaddas below the eyes, has no pigmentation, has no blood vessel issues, has no other systemic conditions, something to fill these khaddas or the depressions or the tear trough will work wonders, right? Because the shadow effect will be taken off. In addition, if somebody has, additional thick skin pigmentation, we need to work on the agents which will reduce the skin pigmentation. This could be cosmeceuticals, it could be lasers, could be peels, and so on and so forth. If somebody has wrinkly skin around the eyelids and it's also causing the shadow effect, then we have to iron out that wrinkles. That could be done non-surgically by plasma therapy. It could be done by Botox therapy, and these are the main ingredients. And if somebody has dark circles because of the additional skin or the loose skin on the upper lids and the lower lids, and along with the bags, which also can cause the depressions and elevations, then we have the surgical modality which is available. I also want to bring here is that nothing in the body happens only externally. There is also changes which are happening inside a body. So we have now also seen that, IV infusions, which vitamin C, glutathione, and some amino acids do wonders and can actually bring down certain amount of pigmentation in certain individuals. So this is kind of an amalgamation of the treatment modalities which we have in our kitty to offer to the patients.
Okay, lovely. And Doc, why don't there's a lot of options available in the pharmacies, in the, over-the-counter kind of remedies. Do they work? And, do home remedies as well really work for dark circles?
See, home remedies, they are just temporary solutions. For example, people talk about cucumber slices or ice packs. Yes, they would work temporarily because what they actually do is they're constricting the blood vessels, the dilated or the increased size of the blood vessel, which is producing more fluid and more pigment below the eyelid skin. So when you put a cucumber or anything cold or coffee, which is a vasoconstrictor, it will definitely bring down the dark circle effect for a while, but it is not treating the dark circle, right? Similarly, off the shelf products, these are not medicated products. These are not physician sold products. I have seen a lot of people using, for example, with no pun intended and no vested interest or financial interest into that, is like, for example, a lot of people in India, especially, are on Fair and Lovely, for example. So now Fair and Lovely is a skin lightening agent, but it has something which is a medicated agent called hydroquinone. And hydroquinone, if it is not given under the care and follow-ups of a physician, can actually have bad effects on your skin, and people do come back with rebound pigmentations around the eyes and on the face. So what's happening is, over the shelf products, yes, they are easy, they are cheap, they are recommended all over. But do they really work? The answer is no. The answer is really no. And people may have tried them many. And then what happens is the client or the patient feels that, oh, I've tried so many things, but nothing works. Nothing works because nothing has been tried correctly in a systematic manner based on why the dark circles are happening. I want to underline this and say again that dark circles can be decreased, can be lightened, but in certain individuals, we cannot eradicate them. But individuals who have early dark circles or have very simple causes of dark circles can definitely benefit from the tailor-made procedure, treatment modalities. So yes, home remedies can be done. I'm not against it. I don't think anybody would say don't do home remedies, but they're not the treatment for dark circles. They're just a stopgap between your treatments which you are taking. Over the shelf, I'm not a big fan of it because they're not therapeutic or medicated products sold by the physicians.
All right, fair enough. And Doctor, so looking at all that you see in the market today, in the marketplace, you deal with patients on a personal level. So, what is your approach? What is Clinica or Dr. Shubhra's approach to treating dark circles?
Clinica and Dr. Shubhra's approach is a very holistic approach because I have learned with my own experience of dark circles because I had very bad dark circles and I remember being told that they cannot be treated. So the approach we take is a very, staged approach for a patient based on the background of the patient, where they're coming from, how much time and money can be invested by them, how much commitment they have, and of course, what are the causes of dark circles they're coming for it. Because there is not one magic wand for every patient. It does not exist. So if somebody comes and say, give me one thing which works, it is very difficult to do that. So for my approach is that I assess the patient in detail. I understand the complete medical history where they're coming from, all the past treatments they have taken in, and assess them step by step based on the factors we discussed from front to back, lateral to medial. What are the the structural changes, aging changes causing the dark circles? Then we make a plan for them. And the plan would then, according to the causes, will have the treatment modalities enlisted. Those treatment modalities may not be necessarily done all at a time. Patient can actually decide what they want to do in a stepwise manner. And we always give them a stepwise manner approach, because if you give everything together, it becomes too overwhelming for the patient. I mean, it will become overwhelming for me also. But the most important thing, which I, as a physician in Clinica demand, is that you need to trust in the process of the treatment which has been given and be compliant and committed to it. I always give a simile of exercise and diet. Like, you cannot get 6 abs just by doing ab exercises. You need to get your food right, you need to be consistent, and then you have to do exercises, right? So there's not only one thing which gives you six packs. So similarly, for anything you want to treat on the face, around the eyes, you need to be systematic, committed, and perseverant with what you are doing.
So Doc, I know you're probably an example of who's probably gone through the same I would say situation or condition. You probably have some experience having experienced dark circles. Can you tell us a little bit about that, and how do you use that in kind of your treatment, your approach towards the offerings that you bring to the patients?
Yes, as I mentioned, I had dark circles and I had other pigmentation on the faces, and this was during the time when I was studying. I was probably in the med school and doing my postgrad, and of course I was not trained enough or exposed enough to the treatment modalities which are available. It's only when I got trained during my fellowships did I understand what are dark circles, what are the options available in India and in US when I was getting trained. And then I understood that, we are looking at, first of all, in a very negative manner. So that thing has to be taken out of the thing, that, you have to be very positive about the condition which is present. And second, as I've been mentioning throughout the session, is that understand why the dark circles are there, understand why it is there. Now, I do get patients who have such a deep pigmentation and we say, no, I mean, this is the maximum I can do for you. Luckily, in my case, it was mainly about the shadow effect. It was mainly about some skin pigmentation, not to an extent which was not treatable, and some of the aging changes. So I went through a journey. I started my journey in 2009 for my dark circles. And it was 2015 or 14 when I could say that, yes, now my dark circles have come to an extent where they're not visible, right? So if you see me today, I don't have dark circles. Of course, I am on a maintenance therapy. I keep doing the treatments on and off to maintain where I have achieved what I wanted to achieve, because it's an ongoing process. Your skin, your bone, your vascularity, everything will keep changing with age. So every time, every now and then you have to be on a lookout for what can be done to maintain where you are. So I'm very, very committed to my skin regime. I'm very, very committed to my health and fitness and the kind of diet I take in. And I'm very, very committed to what I have to do to maintain it in terms of any additional treatments which are needed. And based on this experience, I feel and I understood that dark circles are not as easy as they seem to be to treat. It requires a lot of patience, a lot of commitment, a lot of different cocktails of things. But at the end of it, if you stick to it and you know where you are leading to, you can definitely get results based on individual's condition from 50% to even 100%. But yes, there are cases where you may not get it. So this is the whole knowledge or the gamut of things which I understood. And I think my journey was pretty fascinating because, it used to give me a lot of complexes when I had dark circles. I used to look very dull. In fact, I was going through the archives of my pictures and I was like, oh my God, did I have this pigmentation? And this is how I used to look. And now I'm like, okay, wow, I look like this. And I think I place that example in front of my patients also as my pre and post, and say that if I can achieve it, you can also achieve it. But yes, it comes with a lot of commitment and hard work which is required from their side. It is not a quick fix. It's not going to happen overnight. It is not something miraculous which can be offered to patients. So this is what I think my journey has taught me, and I give it back to my patients and apply it in my practice.
All right, fabulous. Doctor, this is the last question, and I really want to thank you for taking time out. But tell me, doctor, why is it better for patients to come to you versus, there may be alternatives available, there may be options available. People have their, patients have their own comfort zone. People have, patients have their own family doctors. And, why Clinica 5, why Dr. Shubhra versus, the other doctors that are available?
Well, that is their personal choice, of course. That is number one. Number two, I think because I have gone through the journey of dark circles myself, I feel I can present it in a better way. I'm not saying that any other physician or doctor or my colleagues are less qualified or less trained to treat it. Absolutely not. They are all very good, very experienced, very, very talented people. But why me? Of course, I think from my journey, people will understand that it's a very different way of treating the dark circles, the very tailor-made of treating dark circles. There is no right or wrong method of treating the dark circles. And I think the most important thing is, being an oculoplastic person, being an eye surgeon, I understand the anatomy and the pathophysiology around the eyes better. And I think I'll be very confident in trying out different modalities which are available, understand them, how they work, how they don't work. So these are the things. And I think we also have our proprietary program in place where we kind of, as I mentioned, again, I'm using the same terminology again, we tailor-made it, we go step by step. We have grades of dark circles, we have conditions which are present, not present. So that's kind of a whole gamut of things. We have our own mapping of dark circles, which we do. Yeah. And then accordingly, we advise our patients. So I think that is what we are offering. And yes, after all this, if people like the way we treat them and they get results, why not? And but in the end, it's their choice.
Brilliant, brilliant, doctor. Now, Dr. Shubhra, there is one comment, I think, which is really encouraging. Dave Dixit is saying, please do this session again over the weekend. We would like to see and interact with Dr. G more. And I think that is a request from all of us here.
I would take that request with open hands, and if I can spread and share the knowledge as much as I can and benefit people who are suffering from such a common condition called dark circles, why not? Definitely, Mr. Dev, your request has been taken in, and we will look into it and come back with more sessions in future.
Okay, great. Dr. Goel, one more question. What is Dr. G's diet and skincare recommendations, considering she is such healthy and she has such flawless skin?
Well, I can talk about my skin first. So I've been trained for Zeo Skin Cosmeceuticals, that is Zainobaji Skin Cosmeceuticals, by Dr. Zainobaji himself. So I've been using them since 2009 and 10, and I've been on it on a very permanent basis. So that's my skin regime. Plus, I think more than that, in addition to that, I'm on plant-based diet. Sorry if I'm propagating that, but I'm not. But that has really immensely helped me to take away all the inflammation and free radicals from my system, and it keeps my anti-aging clock in a reverse manner. And yes, I'm very consistent with my exercises and my thought processes. I think as humans, we do go through a lot of low moments in our lives, and we need to understand that what you think also reflects on your body and face. So I think it's body, mind, and soul at the end of it, which has to be taken care in totality. I'm just trying, and I'm just trying to be there. But yes, I think I have achieved quite a bit of it, but there's a long way to achieve a lot more for me. So thank you for that question.
Thank you. Thank you. Dr. Shubhra, we can't thank you enough. We really appreciate it. With your busy schedule, I know you were in a couple of other towns, and you keep visiting different institutes. You are engaged with academia. You want to give back to the society and community at large. So we really appreciate you for that. Thank you very much, and we hope to talk to you soon. Thank you, Dr. Shubhra.
Thank you for your wonderful session. Thank you.
Thank you.